Welcome. Thank you again for joining us for some important updates and for appropriately spreading yourselves out. We appreciate that. As we are all aware, the issue of COVID-19 and how it affects our Oklahoma City Metro has been as fast-moving as the virus itself. We have moved quickly because our public health officials tell me this is the most serious pandemic our community has faced in the last half-century. Even considering conservative estimates of mortality rates and contagion, the loss of life in Oklahoma City would be profound if we did nothing. We need only to look at the cities that first confronted COVID-19. As I said Sunday, we have an advantage they did not have. We have knowledge and the opportunity to move faster than they did. It was less than 100 hours ago that our first local case was identified. When our first locally transmitted case was confirmed on Sunday, just 48 hours ago, that very day we declared a state of emergency in Oklahoma City. As you know, the actions I took Sunday were not applicable beyond the functions of city government, and I encouraged everyone to respond in their own lives. Many have, and I commend all those businesses and organizations who have taken unprecedented steps to limit the opportunities for the virus to spread locally. Limiting close personal contact is our only real tool of mitigation. Today, we are announcing further steps to accomplish that goal. Yesterday, the CDC asked all cities that have local transmission, as we do, to close bars, gyms, movie theaters, food courts, and to limit restaurant service to carry out or delivery only. These are actions that have already been taken in many American cities, including Tulsa earlier this afternoon. On the advice of the public health professionals at the Oklahoma City County Health Department, in close consultation with the city manager and his emergency management team, and under the authority granted to me by the ordinances of our city and by the declaration of an emergency, we are announcing those actions today. Specifically, beginning at 5 o'clock today, all bars and similar venues that do not serve food shall close to the public. Effective at midnight, athletic gyms, exercise facilities, movie theaters, and shopping mall food courts shall close to the public. Effective at midnight, the casino at Remington Park shall close to the public. And starting at midnight, all breweries, bars with food, coffee shops, and restaurants shall be limited to takeout or delivery only. Those are the measures we are taking today. Moving forward, as we consider further measures as necessary to protect public health, we will continue to be guided by science, the advice of public health professionals, and the obligations we have to the people of this community. The public health apparatus in Oklahoma City has many parts, but we are all working together. The city continues to work closely with the City County Health Department and with the state. I communicate with Dr. Patrick McGough almost every 10 minutes, 24/7. I spoke to Governor Stitt's office earlier today, and they are encouraging cities like ours to follow the advice of our local city county health departments. I also speak to the mayor of Tulsa almost hourly so that we can closely coordinate our response. My role in this is primarily to use my authority to limit the opportunities for the virus to spread. Dr. McGough's obligation is that as well, but also to address the direct health implications, and he will speak to that shortly. Let me close by saying it is heartbreaking to make these announcements today. I am well aware how they will affect the economics of our city and our residents. It is cold comfort to know that virtually every city in the United States is facing the same challenge. We in Oklahoma City must work in the days, weeks, and months ahead to mitigate the economic fallout of COVID-19. If we can find a way to support local businesses and their employees during this pandemic, please take those opportunities. I am also very aware of other announcements that have been made in recent days, such as the closure of schools, that will also have secondary effects on our people, and our community must rally together to mitigate those effects as well. Just 3 weeks ago, a lifetime ago, I delivered my State of the City address, and I closed with these words. Part of empathy is having the wisdom to know that today it may be your neighbor who bears the load, but tomorrow it may be you. So be a friend and help another carry on, for it won't be long till we each need somebody to lean on. Let's lean on each other in the days ahead. I assure you there is another chapter on the other side of this one, and we will get there together. Now I'd like to welcome Dr. Patrick McGough, Executive Director of the Oklahoma City County Health Department, our close partner in this effort, to share some other updates, and then we would be happy to take questions. Dr. McGough.
Thank you very much, Mayor Holt. And I just want to say what an honor it is to continue to work with you, and I appreciate so greatly your desire to help us, help the community, and to try our best to work with CDC collectively, and it truly is an honor to work with you and your team. To the citizens of Oklahoma City and Oklahoma County, we are facing an immediate crisis. COVID-19 spreading from person to person is in Oklahoma County. As the mayor mentioned, we now join the countless other cities around the nation and around the world as we face a new reality, adjusting to a life where we must take extreme precautions to protect ourselves and our loved ones and minimize this impact of this virus to our community. The first priority for us is to stop the spread of COVID-19 in Oklahoma County. The actions taken today by Mayor Holt are a step in the right direction. Avoid social gatherings of 10 or more people. It is imperative you stay home if you begin to feel ill with a fever or cough, and call your medical provider. If you are immunocompromised or over the age of 60, please take today's warnings seriously. You are at higher risk of complications if you are exposed to COVID-19, and the only proven way to protect yourself is to stay away from groups of peoples or individuals who may have symptoms or may have been exposed to the virus. For our Oklahoma County residents who are young, healthy, and don't think they need to worry, please note that your actions can mean the difference between life and death for your loved ones, your neighbors, and citizens of our community. We must all be vigilant in practicing hygiene to keep this virus at bay, particularly by washing our hands for at least 20 seconds multiple times throughout the day. There is a video on our website at occhd.org on the proper way to wash your hands. When you cough or sneeze, make sure you cough into the inside of your elbow and away from other persons. While there currently is no vaccine to protect against COVID-19, the best way to prevent infection is to take the everyday preventive actions I've described today and avoid close contact with people. While today's restrictions are meant to limit gatherings in our community, we know there are still places you will need to go outside of your home or place of work. Please be mindful of your plans and where you are going. Whether you are at work or the grocery store, maintain distance between yourself and others of at least 6 feet. I cannot stress enough, if you feel ill, if you are sick, please stay home and call your doctor. Clinicians may recommend testing for other respiratory illnesses, including the flu. Those who are uninsured may call the state COVID-19 hotline for community resources. When a community crisis hits, we here in Oklahoma County rally around one another and work to help our most vulnerable. COVID-19 is here, and while we likely continue to see increased numbers of cases in the coming days and weeks, today's mitigation measures help us shorten the duration and depth of this virus in our community. I want to thank very much the mayor again and his staff and our Board of Health here at the Oklahoma City County Health Department for all of their encouragement through this crisis. Thank you. Questions?
Yeah, any
If
questions?
anyone has questions, we have a line here, so let me know. Yeah, go ahead.
This could be the county or mayor, real quick. Do you know of other cities like Bethany that exist in Oklahoma County that are going to try the same thing? It's probably the county treasurer. Mayor, do you know that too?
I'm sorry, we couldn't hear the question.
Sorry. Do you know right now that other cities like Bethany, Warriors, those that exist within the county and Oklahoma City itself are going to be trying the same measures that the Oklahoma City itself is doing?
Yeah, good question. So you are aware of something many people aren't, that we actually have many municipalities in the metro, and those are not just neighborhoods. Those are their own cities with their own mayors, their own city council members. And so we certainly will make our proclamation available. I don't necessarily presume to know, what their ordinances say about what their, who can do what in their cities, so they have to make their own, legalistic decisions. But I do think it is, I hope we can not have a patchwork of regulation across the metropolitan area. So I do suspect, we'll be joined by other cities, but that is entirely their decision. Now, he may have a different opinion because he has all those cities in his jurisdiction. He may wish that they all follow his advice. I would like to let them have their own independent thought process, but we will certainly make our language available to them if that would be helpful. That's one of just the practicalities of this. As people wonder what takes time to get things done. Sometimes, we've got to get the lawyer in the room. We've got to write this stuff out. That can take a little while, and we can maybe help others jumpstart that process with the work that we've already done. You want to speak to the other municipalities in the city?
Certainly. So our recommendations as the Oklahoma City County Health Department would not change. We stand by the same for all folks involved in Oklahoma City and Oklahoma County.
Trivia, that question?
Will there be any financial assistance to businesses that are being forced to close? And what about the people in restaurants who rely on their paychecks? What's going to be happening for them?
Right. That's obviously the secondary effects. It has literally been a life or death decision this week, and so we have chosen life, but we know that there's no good outcome here, that there's a bad choice on both sides. Something bad is going to happen, and in this case, by choosing life, we are also choosing economic challenges for restaurants and bars and their employees. I am not as knowledgeable. Others would probably be better to ask about what I'm hearing about the SBA and those types of federal and state assistance. We don't have anything like at the city level proper, although I do anticipate working with local philanthropy. I understood even on the way over here, I heard that the United Way has started a fund, so that's an aspect of the recovery effort as well, would be philanthropy, and as mayor, I certainly want to encourage that and facilitate that. For the type of federal and state programs that I've heard rumor of, it's probably other people would have more knowledge of that than I. But we're certainly, as a city, we want to pursue all of that because we are well aware and very conscious of the effect this is going to have.
I think Storm has a question for you.
Yeah, what guidance has the governor given on making these closures?
So, yesterday, these closures that we have enacted today are pretty common right now around the country, so we've been following that, and it seemed like every hour another city got a little closer, and it was yesterday, it was Dallas and Little Rock doing some of the same things that we did today. But the CDC pushed us, really. When we saw the CDC's new recommendations come out yesterday that are basically right down the line with what I just described, that was pretty compelling. That certainly put us to work to implement that here in Oklahoma City. We did want to be in touch with the governor's office about that, and their feeling currently was that it's best for local communities to make their own choices and to listen to the advice of every county's got a health department, and to listen to the advice of their local public health professionals, that maybe the situations aren't universal across the whole state. And so they certainly didn't discourage us from doing what we've done today. They felt that if that was the advice of our city county health department, that is what we should do.
I don't know if this is more for the state health department, but maybe you could answer. We've got a lot of emails from people who don't know who to call about being tested. They're calling their doctors. Some doctors are saying call the county, some saying call the state. Can you shed light on that?
Yes, so we would still be directing people to call the COVID hotline that the state has out there, and you can get that number off of our website, occhd.org. And also, we do encourage, if you have a provider, call your provider's office before that you show up. Thank you.
A couple of questions. Do we know how long these closures are going to remain in place, or is that going to go in the air right now?
That's a great question, and I didn't have that in my remarks. It will be in our proclamation. The date that we used on Sunday for the original proclamation was April 12th, sort of at a minimum, and that's the same date we will use for these closures and regulations that we introduced today, understanding that we certainly reserve the right in the interest of public health to extend that. But we kind of feel like there is some assistance in some predictability and understanding, okay, well, I'm not opening my bar before April 12th. I know that, and I can plan for that now. Now, maybe that you're not opening your bar even longer than that, but at least you know now that it's not going to happen in the next month. So that's why we have dates in there, but we certainly do not consider them dates that we have to stick to, because we also, we're keenly aware that the CDC recommendations at this point tend to be moving in more of an 8-week cycle, and we're realistic that we know that's probably what we're really in, but we don't want to close things unnecessarily, obviously. So we probably gave ourselves a shorter time frame. But so April 12th though is the date for today.
Mayor?
Okay. Mayor, you're obviously very well connected with our small business owners. What has been the general feedback from them?
Well, what I have liked to see in these last few days is a lot of the restaurants were already moving towards what I just described. I was getting, I'm on a lot of email lists. I buy stuff, so I was getting these notices coming in every hour from another coffee shop or another restaurant saying that by Wednesday we're going to go to carry out only, and so in my conversations over the last 24 hours with people related to the Restaurant Association or just independent operators, it tended to be acceptance. Nobody's mad at anybody that I've experienced. I may hear from them later, but right now, everybody's they understand that this is the national situation that we're in, that it's the right thing to do for the community at large. And if we can try to make it work, we're not closing restaurants. You can still eat food from a restaurant today and tomorrow and the day after, and we encourage you to do so. You're just going to have to pick it up or get it delivered. And again, many of the restaurants were already moving that direction. So I guess I've been heartened that the small business community is trying to be, proactive, and that we're trying to kind of move at the same speed. This is obviously, we're pushing it a little bit farther today, but again, a lot of small businesses were already moving this direction.
I heard of a grocery store earlier today that was limiting how many people could be in there at one time. Is that something that's recommended?
Well, these are issues we're going to have. We don't stop talking after this press conference. It's not. Every day we'll continue to reevaluate measures that should be taken and continue to follow CDC guidelines. And that specific issue about grocery stores and things, I don't know what you've heard about that.
So we understand that people need basic supplies from a grocery store. So I'm sticking with, let's be in a crowd of less than 10 people. If you go into the grocery store, don't bunch up and talk together, stay away from people that may be infected, and especially those that are over 60, those that are immunocompromised. I think it's the same thing over and over again. The same thing if you walk into a restaurant and you're going to pick up some food and there's a whole lot of people standing there together, please don't do that. Don't join them. Back up, give them some room, and step forward later when some people get out of the way. I think it's just common sense, and we appreciate so much, so many businesses, so many events. People are rallying and coming together and making their own decisions, and that is greatly appreciated by both the mayor's office and by City County Health Department.
Speaking of grocery stores, I only know a little bit about this, but I have followed the news in the last 24 hours that the governor has sort of proactively reached out to some of the larger chains to get them to open for senior-only hours at the beginning of the day, and I thought that sounded very proactive.
Will you be ordering shelter in place for people not to leave their house at all at any point?
Well, we'll continue to rely on the advice of public health professionals, and that's not where we're at today. Obviously that's a scenario we want to avoid, and by doing what we're doing today, we hope that we're avoiding it. We're trying to do everything we possibly can and quickly. Again, we're doing all this within 48 hours of the first locally transmitted case, and he would know better than I, but in the history of pandemic response or any kind of virus response in Oklahoma City, that's beyond unprecedented, so right. To be doing what we're doing. But we're doing it because of the seriousness of the virus. I hope we don't end up there. I recognize there are places in the world that have ended up there, and again, they didn't take, however, because they just didn't have the advantages we have of knowledge to take the actions that we've taken now early enough. And so my hope obviously would be that we can avoid what you just described, which is kind of that's the last resort. Sheltering in place at your home is there's nothing else we can do after that, I don't think. So we're trying to push it, pretty far though today.
Doctor, could you just spell your name for us, please?
Certainly, it's McGough, M-C-G-O-U-G-H.
He tells me some call him Dr. Mac, if you want to go with that. But.
That is true.
Thanks for doing that.
All right, thank you very much.